Hello! We are starting our NCLEX review course with Professional Standards of Nursing. We will first do a quick overview of what information and then dive deeper in each section. This is a key area of the exam as it ensures that all nurses practice ethically, legally, and professionally in any healthcare setting. Why are professional standards important? Professional nursing standards guide our practice, ensuring that nurses provide safe, competent, and ethical care while advocating for patients. These standards protect patients, nurses, and the integrity of the profession. Key areas of professional nursing standards. First, scope of practice, defined by the Nurse Practice Act in each state, outlining what nurses can and cannot do legally. Second, ethical principles, including autonomy, beneficence, non-maleficence, justice, fidelity, and veracity. These help guide nurses in making difficult patient care decisions. Patient advocacy is crucial. Nurses must always speak up for their patients' rights, ensure informed consent, and act in their best interests. Now, let's talk about delegation and supervision. It's important to follow the 5 rights of delegation: the right task, the right circumstance, the right person, the right direction, and the right supervision. Legal responsibilities in nursing are fundamental. Understanding liability, malpractice, HIPAA, which covers confidentiality, and patient safety regulations is essential for every nurse. How do these concepts appear on the NCLEX? Well, let's look at some scenario-based questions. For example, a nurse observes a colleague giving the wrong medication but not reporting it. What is the best action? The correct response would be to report the error according to facility policy. Prioritization and delegation questions often come up, like, which task can be delegated to a UAP? Well, taking vital signs can be delegated, but patient education cannot. Now let's talk about ethical dilemmas. If a terminally ill patient refuses further treatment, what is the nurse's role? The nurse should respect patient autonomy and support their decision. For another study tip, make sure you know the Nurse Practice Act for your scope of practice. Also, memorize the ethical principles and understand how they apply to real situations. It's crucial to understand legal responsibilities like HIPAA, informed consent, and reporting unsafe practices. And of course, practice NCLEX-style questions to reinforce your understanding of professional standards. By mastering these concepts, you'll be well prepared not just for the NCLEX, but also for real-world nursing practice. Now, let's dive deeper into each section I mentioned earlier in more detail. Our first topic in this section is population health nursing, and there are a few topics to cover in this section. Personal standards in nursing, Nursing Code of Ethics, ANA guidelines. Autonomy is respect for patient choices. Beneficence is promote well-being. Non-maleficence is do no harm. Justice is fair and equal care. Fidelity is keep commitments. Veracity is tell the truth. Cultural competence is understanding and respecting cultural differences. Professional boundaries are avoiding dual relationships and maintaining confidentiality. Critical thinking and clinical judgment are essential. Nurses must use evidence-based practice for patient care. Population health nursing focuses on preventing disease and promoting health in populations. Let's talk about the levels of prevention. Primary prevention includes vaccinations, education, and lifestyle changes. Secondary prevention involves screenings and early diagnosis, such as mammograms and pap smears. Tertiary prevention is all about rehabilitation and chronic disease management. As we consider healthcare disparities, we must think of social determinants of health, or SDOH, which include factors like economic stability, education, healthcare access, and the neighborhood environment. Health disparities are differences in health outcomes that are closely linked with social, economic, and environmental disadvantages. These differences can be based on race, ethnicity, gender, income, location, and disability. Let's look at a few examples of health disparities. For instance, higher maternal mortality rates are seen in Black women. There are increased rates of diabetes in Hispanic populations. And limited healthcare access is a significant issue in rural areas. Nurses play a crucial role in addressing health disparities through advocacy, policy change, patient education, and health promotion. Nursing assessment also falls under population nursing. A comprehensive health assessment must be done for all people groups. Such assessments include evaluating physical aspects such as vitals, pain, skin, neurological, cardiac, respiratory, and gastrointestinal systems. In psychosocial assessments, for example, nurses examine mental status, coping mechanisms, and family support. Cultural assessments, nurses must consider religious beliefs and dietary preferences. These assessments will analyze functional activities of daily living, mobility, and independence. SPAR is a form of communication nurses utilize to relate information obtained about the patient, including situation, background, assessment, and recommendation. Minority groups must be considered when considering population health nursing. They are often affected by healthcare disparities. Certain groups of people are more susceptible to illnesses than others. Obesity, diabetes, renal disease, and cervical cancer are more common among Hispanics. Smoking and the use of alcohol, among other things, are more common among Native Americans and Pacific Islanders. Obesity, diabetes mellitus, hypertension, heart diseases, asthma, and cancer occur more commonly in African Americans. There are a lot of healthcare considerations for different groups of people. so nurses must learn how to handle them all. One way is by showing cultural sensitivity. To do that, nurses should respect all their patients' traditions, beliefs, and values. Common barriers that affect certain groups of people may include language, mistrust, and low health literacy. Strategies to overcome barriers connected to language include using medical interpreters, not family members, and providing culturally appropriate educational materials. One group of people nurses care for are individuals with mental health problems. Common conditions include depression, anxiety, schizophrenia, and bipolar disorder. Nursing interventions for mentally ill patients is therapeutic communication, and it involves active listening and asking open-ended questions. Safety first when caring for mentally ill patients. You must always assess for suicide risk by asking directly about self-harm. Medication adherence is also crucial. Monitor for side effects, such as tardive dyskinesia in patients with schizophrenia. Battered individuals and victims of abuse or neglect are another group of people nurses care for. They often show signs of abuse, like unexplained injuries, fear of their partner or caregiver, and withdrawal from social interactions. Mandatory reporting is essential for any patient that is suspected of abuse of any kind, for example, sexual, physical, financial, etc. Nurses must report any cases of child, elder, and dependent adult abuse. Nursing actions for patients who are suspected of suffering from any kind of abuse is as follows. Ensure privacy when asking about abuse. Use direct but sensitive questioning, like, do you feel safe at home? Provide resources such as hotlines, shelters, and social services. Intellectually disabled individuals are yet another group nurses care for communication. Use simple, clear language and repeat instructions as needed. Health risks. They have a higher risk of obesity, cardiovascular disease, and undiagnosed conditions. Nursing interventions. Include caregivers in care planning. Provide visual schedules and written instructions for clarity. Another group set is older adults, or geriatrics. They often face common issues such as polypharmacy, dementia, falls, and frailty. When it comes to nursing care for older adults, fall prevention strategies are crucial. This includes ensuring clear walkways, the use of call bells, and providing non-slip socks. Cognitive assessments are also important, using tools like the Mini Mental State Exam, or MMSE. Additionally, screening for elder abuse is essential, looking out for signs of neglect and financial abuse. Military veterans is yet another group. They face unique health concerns, including PTSD, depression, substance abuse, chronic pain, and traumatic brain injury, or TBI. Nursing care for veterans involves asking about military history, to understand potential health risks. It's important to provide trauma-informed care. Refer to VA services and support groups for additional resources. Health risks for prisoners. The next people group include higher rates of chronic diseases, mental illness, HIV, and TB. Nursing role for prisoners are to provide non-judgmental care and maintain confidentiality, report self-harm or waiing giltit aim komai and take up koikin kai kiti. Threats while ensuring you maintain a supportive environment. Ensure treatment for infectious diseases such as hepatitis and HIV, and maintain confidentiality to build trust. Immigrants and refugees. Yet another group of people face numerous challenges. Language barriers often hinder effective communication and access to health care. Additionally, the fear of deportation can prevent individuals from seeking necessary medical care. Nursing interventions are crucial for supporting immigrants and refugees. Utilize professional medical interpreters to facilitate accurate communication. It's also important to assess for PTSD and trauma history, which may affect health behaviors and mental health. Ensure culturally competent care by understanding cultural beliefs and practices that may impact healthcare decisions.
All nurses to the nurses station.
Then we have individuals with chronic illness, often face common conditions such as diabetes, heart disease, chronic obstructive pulmonary disease, cancer, and kidney disease. The nursing role in patient education for patients with chronic illness is crucial. Nurses need to provide information on medication adherence, lifestyle changes, and self-management strategies. Monitoring for complications is essential. It's important to understand the complications that can arise from chronic conditions. Palliative and end-of-life care focus on pain management, emotional support, and quality of life considerations. We have just taken an in-depth look at population health nursing and the different groups of people nurse must care for. Here are some NCLEX study tips for this section. Know social determinants of health. Understand how economic stability, housing, and education affect health outcomes. Use therapeutic communication. Develop skills in empathy, active listening, and clarity to effectively communicate with patients facing mental health challenges and victims of abuse. Focus on safety in high-risk populations, such as the elderly, prisoners, and military veterans, ensuring timely interventions. Be aware of signs and symptoms associated with conditions like diabetes